President Trump estimates more than $500 billion in medical savings over the next 10 years because of his pharmaceutical deals to drop U.S. drug prices. So how can consumers take advantage of these lower prices?
Dr. Bill Padula is a health economist at USC Mann School of Pharmacy. What a title.
Thank you very much.
Thank you for being here. We appreciate it. We want to understand, what are these deals between the White House and the pharmaceutical companies?
It's a good question. There's a couple different deals going on right now. I think the one that a lot of people are talking about between pharmaceutical companies and the White House, called Most Favored Nation, MFN. That's the one where pharmaceutical companies are agreeing to set prices on drugs in the United States to what people are paying overseas in Europe and in Canada and the UK. And so what we'll see happen is likely they pay lower prices, and therefore we'll pay lower prices in the United States as a result, the same
Just
price.
like that?
Yeah.
Oh.
Yeah, 17 companies have signed up and agreed to do this in the United States.
So will consumers actually see these prices anytime soon?
Well, that's a good question. Consumers won't see prices when it comes to going to the pharmacy and refilling your generic prescription for a statin. You pay $4 at CVS, you'll keep paying $4 for that. Where we will see some changes actually in things like weight loss drugs, fertility drugs. These are expensive, right? And if you don't have diabetes, you can't get your insurance to cover Ozempic, for instance, for weight loss. And so Trump administration has set up these marketplaces for direct-to-consumer purchasing of many of these drugs. And through that, actually, it's more affordable because it cuts out a lot of the middlemen in the pharmaceutical supply chain. Wow. And so we end up in this position where maybe patients will save a couple bucks by going online, buying it directly from the manufacturer, and ending up with a better deal on a lot of these drugs.
Well, so they don't have to necessarily go to the drug manufacturer. You've said that insurance companies may add more to their coverages.
That's right. Well, this comes down to that most favored nation policy that I mentioned before. If the price of a drug is lower in the United States, especially in advanced therapy, like for cancer, then we'll end up in a situation where an expensive drug that an insurance company didn't cover before may now cover it. And so a patient's not going to see a change in the price of what they pay out of a copay, let's say, for treating cancer, which can be hundreds of thousands of dollars a year. But a drug that wasn't covered before is now covered. So that's a huge change for us in our ability to access more affordable treatments for different severe diseases.
Oh, okay. Well, Dr. Padula, a big point from President Trump, he mentioned that he wants no more middlemen, like you mentioned earlier, for these drugs to be sold directly to the consumer. How do you see this moving forward? Is this going to be a feasible long-term plan?
It's a good question. I think there's going to be a lot of change in the way that pharmaceuticals are marketed to people as a result. You know, if we see lower prices, it's going to lack justification for why these middlemen exist in the supply chain to begin with. And so there may be a restructuring over time. It's hard to tell how these policies, which have just been enacted in the last 12 months, are going to play out over the next decade, but we expect there's going to be a lot of change.
Okay.
All right. Well, this is a fascinating topic and one a lot of people want to know about. So thank you so much for being here and explaining it this morning.
Thanks for having me. My pleasure.
Yeah, we appreciate you breaking it all down.
Yeah, and coming in studio to do it. Thank you.